in a way that will keep everybody safe. So again, I want to thank you for your support. It meant a lot as we showed up everything we had so that we didn't have to lay off anybody during the crisis, and we could continue to serve on the publicly funded and the privately funded side. Outreach is a blend of private funding and public funding. The public funding is for Youth Connect. It comes from the city, from the Department of Human Services, but all the outreach in Upper Northwest is funded directly by Friendship Place with private funds, and then we have a partnership with the Georgetown Business Improvement District for a newer outreach that we've been doing for a year in Georgetown. We are doing well during the crisis at Friendship Place. As I mentioned, we are actually working on our budget for FY21, and we will start our strategic planning process this week. Outreach goes way back at Friendship Place. It's the first service we ever offered 29 years ago. We started with a used van, some sandwiches, some blankets, some bottles of water, and of course, through the years, the service has evolved with the great leadership that we now have on the team, and you'll hear from the folks who are working directly on the street today. I really want to commend the outreach teams for the amazing work done during the COVID emergency to go out on the street, to reach out to people, to make sure that people stay safe and connected. So I want to thank you all for doing that. We have a wonderful staff. We're going to hear from them just after Sean. I'm going to turn it over to Sean. Sean is our Community Solutions Officer. As such, he's in charge of all the family services and outreach, but also of Aim Higher, the job placement program, and of the Veterans Services Division, which provides rapid rehousing in DC Metro to many, many veteran households every year. So over to you, Sean.
Thank you, Jean-Michel. Good afternoon, everyone. Again, my name is Sean Reed. I'm the Chief Community Solutions Officer at Friendship Place. It is my distinct pleasure this afternoon to introduce some amazing staff members at Friendship Place who serve in our street outreach service capacity. The reason why I said distinct pleasure is that I've had a chance to be part of this group in supporting and leading the team really for the last 5 years in my prior position as Division Director for the Welcome Center. Outreach is so incredibly instrumental in engaging in the initial steps of relationship building, in helping individuals who are both sheltered and unsheltered begin to move through the process of ending their experience with homelessness in the District of Columbia. I'm also going to share here in the chat bar that we have recently launched an Friendship Place Street Outreach Hotline number that members of the community can call in, as well as individuals, if they are in need of services from our street outreach team. Those messages are regularly checked and distributed amongst our outreach team members to be able to respond to the needs in Upper Northwest, Ward 3, in the Georgetown Business Improvement District. And so with all of that, I'd like to introduce the following members of our street outreach team. I think all, if not most, are here in the session with us this afternoon. Antoine Gillis is our project coordinator for street outreach services, and he is the direct leader overseeing operations of both our youth street outreach and outreach for single adults. Our youth street outreach team consists of Shayla Suarez and Sierra Barnado. Both have been with the group for I know Shayla, you've been with us almost a year, and Sierra, you're coming up on 3 years with our youth street outreach team. And then Liza Porras and Dana Long are our two street outreach specialists that are serving in the Georgetown bid, as well as throughout Upper Northwest and Ward 3. And so I'm excited to hear from each of them today and the work that they've been doing in many ways life-saving work with individuals who are experiencing unsheltered homelessness in the District of Columbia. It's going to be well-informed, and I hope that you all will learn a tremendous amount about what we're doing at Friendship Place. And so I will turn it over, I guess, back to you, Chris, to kick us off, right?
Very good. Yeah, very good. Thank you. So I'm not sure who we were intending to shoot first. Sean, who on your team would like to go first to talk about their work? Antoine? Okay, Antoine, over to you.
All right. Hello, everyone. Thank you, Sean. Thank you, everybody. My name is Antoine Gillis. I'm the project coordinator of homeless services at Friendship Place. I've been doing street outreach in the DC area 15 years now. Street outreach is very, very important to some of our people who traditionally won't, leave certain areas to seek the services that they need. What we do is we help people meet their basic needs and build relationships, build rapport, in order to be that bridge to help them get to where they are. Of course, we have an adult team and a youth team, so homelessness looks different, on both ends. So just finding that balance and helping folks to meet their needs. That's what we out there doing every day, collaborating with different organizations, being that bridge. So I can turn it over to Shayla to talk a little bit more about some of her outreach experiences, and we'll take some questions and stuff later.
Hi, everybody. So my name is Shayla. I work on the youth street outreach. So I primarily work with people who are experiencing homelessness between 18 and 24, and within the lines of Columbia. We most of our day going through high traffic areas in the city, or shelters or places where people are trying to get basic needs like meals, showers, laundry, access to social services, and then we connect them to different housing providers. So currently I work with and we help connect people who have multiple identities. And I think that youth homelessness looks a bit different in the district compared to adult homelessness, because a lot of times these youth get together, they try to help each other, they have a friend that let them stay one place one night. Yeah.
Great. Who else would like to speak then?
You're wanting to say anything?
Hi everyone, my name is Sierra Barnado. I've been with Friendship Place for almost 3 years now. I'm a youth street outreach specialist, and I was lucky enough to go to the Welcome Center. I think Friendship Place outreach is unique because, like Antoine mentioned, we are youth and adults, 18 to 24, and anyone above that age. So we can interconnect as we do outreach in the city. I feel that outreach is very important because a lot of these systems are interconnected, like the criminal justice system, the foster care system, homelessness, it's all interconnected. And our team is very well-rounded because we are able to reach and relate to many of our population. For example, I'm bilingual, so when I came on the team, our Excel spreadsheet where we record all of our things was able to reflect a lot more of a population of non-English speaking people. And also in the Welcome Center as well. We all use Language Access Helpline, but I was able, since coming on, able to get a lot of Spanish-speaking youth into these type of programs, our transitional housing programs. We also do different things. Outreach isn't just basic needs, getting connected to shelters in cold and heat. It's also passport services. We can be really creative at Friendship Place to do a lot of different things on outreach, as far as like helping people with like interview stuff, helping people with immigration services. Basically, we're like resource specialists, just to help people. And as people are traumatized from being in these different systems, we're able to meet people in all 8 wards of the city, which is also very unique to us, because we're able to see someone who may have had a bad experience at another provider, and doesn't feel comfortable going inside, so we can go to them in a park, and, you know, we can meet them in a McDonald's, and where they feel comfortable to get these things done.
Great. I think we also have Liza and Dana to hear from, so either of you? I'm going to make sure Liza's off of mute.
Oh, hear me now?
We can now, thank you.
Sorry about that. My name is Liza Forrest, and I am actually very, very brand new to Friendship Place and Street Outreach, having what is turning out to be a pretty unique experience of starting just a couple of months ago in the middle of the pandemic. But I think that this experience so far has really kind of made evident for me as I'm learning the ropes of getting understanding of my position and meeting people where they are, the importance of street outreach. You know, at this time, services are shut down across the city, so people who are experiencing homelessness don't have the traditional places to go. So that sort of really heightens the importance of the work that we're doing. And so at this time really has made that evident to me. And I can see that, you know, that we're out there making that effort to sort of be that bridge of getting people connected to the services that they need, that more than ever that value is seen by the people that we're providing services to. Also, just something that I've been sort of learning, and I feel like I've been lucky enough to experience at least once so far in my first couple of months starting to work, is that this sort of the idea of the housing first approach, like the street outreach position really is important to ultimately getting people housed if people are not able to access services from going to a traditional brick and mortar service place because of the trauma that they're experiencing, being able to bring those services to them and then ultimately get them connected to eventual housing placement is critical. Otherwise, that housing opportunity might not be available. And I've been lucky enough to have that experience so far once of being able to connect somebody who, and it takes a long time of relationship building. A team member, Shayla, had dropped off some goods and needed services in her card at his tent back in February, and it took him a while to come around, and he finally reached back out to her. And since I'm on the adult outreach team, she pointed him to me, and I was able to work with him. And another one of our service providers in the district was doing a housing lottery, some that Sean made us aware of, and we were able to get him signed up, and he's now matched that housing. So through the sort of long relationship building, connecting people to resources and building that trust, and being connected to the other service providers, we're really able to move people into housing that otherwise might not have that opportunity. So it's been really a whirlwind experience these past couple of months, but I'm really so grateful to be a part of the team. And Antoine is an incredible wealth of knowledge and from his experience and how to think about meeting people where they're at and putting the individual first. So I'm really excited to be in this position and be a part of this team.
Well, exciting to have you. Thank you, friends. Thank you, everyone, for sharing. I'm not sure, did we miss Dana, or is she on the call and about to speak, or? Okay. If not, I'm going to go to Sean here and ask, what's the flow in terms of the outreach team? How do people hear about those who are in need? How do the people who are in need hear about us? How does it connect with the Welcome Center and all of our other programs? Can you give us a bit of an overview, Sean?
Yeah, so one of the ways that we have grown our outreach services, and I'm going to actually kick this around to some of the other members again, including, I know Sierra has some other insight on this. In the district's strategic plan to end homelessness, they refer to outreach services if we frame our homeless services system as a house, per se. Outreach is kind of that front porch. It's the entryway into the service delivery system. It's in so many ways, it's often referred to as low barrier, so really no restrictions, no requirements. There's not a mandate that you have to provide a name or an ID or have income or any sort like that, but really is about connecting people with one another. It's the beginning of building relationships. It's also understanding that individuals who are experiencing homelessness, especially those who are often in an unsheltered situation, that there is an increased possibility of some pretty significant trauma that they have experienced in their lifetime. The experience of homelessness in and of itself is traumatic. And so outreach services goes in, they come and they enter into the experiences of individuals as guests. We don't force our way in. We work in through routine, consistency, and being present, and building our identity of who we are and how we may be able to render services and provide support. That's how we build relationships. Because outreach has been historically a part of the Welcome Center since the Welcome Center opened its doors in 1993, it's just always been a fluid movement between our street outreach services and our Welcome Center drop-in center. Years ago, we made some adjustments where we reduced the number of days that the center was open and made it so that those days that we were closed could be readily available for individuals who are unsheltered, who would never come through the door when it's a very busy day, that they could gain access to a shower, to do their laundry, to get other supportive services in that way without needing to feel that they have to be in competition or to be in this larger environment with many, many other individuals. And also in the same way, we get information. Individuals who are experiencing homelessness often are the key people that share with us someone else who's in need. That they may see someone who has been moving up and down the corridor of either Connecticut Avenue, M Street in Georgetown, Wisconsin Avenue, in different parts of Upper Northwest. Sometimes the individuals that give us the tips of someone in need are other individuals that we're working with. And they are such a significant and helpful way of brokering new relationships with individuals that they can say, hey, you can trust these individuals in what they're doing. They have your best interest in mind. If you want to move towards the process of getting housing, they know how to help us get there. And so that has been a huge part, and it's the same, I would say, for youth from what you all have shared in the Youth Street Outreach team. Youth being able to say that you can trust this person is huge. And so that is a huge part of what we do. I think it's also important that we identify that, especially in our Youth Street Outreach, that there was a large number of our youth in the district experiencing unstable housing and homelessness that identify as LGBTQ. That on a national average, more than 40% of unaccompanied, unsheltered youth identify with LGBTQ community. And we see a very similar representation in the District of Columbia with that. And so ways that we have been able to incorporate best practices, one is that our outreach teams have gone through training in LGBTQ safe spaces. Nearly all of the team over the last couple of years have also been engaged with the National Network for Youth and have undergone training in human trafficking and how to be able to identify that. And we work with other partnerships like the Amara Legal Clinic in D.C., and understanding how we can help connect individuals who are in human trafficking situations, be able to get connected to legal services that can help them navigate out of those situations as well. Tremendous partnerships I know I've seen here on the call today. Some of our wonderful partners from Georgetown Ministries that we have worked in partnership during these pandemic months in outreach services in the bid. That they have been a wonderful partner of ours that we have worked in connecting and helping to identify people in Georgetown who are in need. So we do work as a collective unit, not just as Friendship Place, but as a district as a whole in working to meet the needs of unsheltered homelessness. And all of those different teams, we're able to vouch for one another's services. And so if we have a trusted partner in another part of the city, it's great if someone wants to come and engage with us, but there could be undue hardship from traveling from Ward 8 all the way up across town to engage with our services. So we can say, there's a group here that we trust and we believe can also help you and be able to do those introductions. We always aim to do that as well. And so that is one way that we kind of work to bridge through that front door of services in street outreach. And so I do want to shift it back to Sierra for perspective as well that I think is really important. And then just to see if there's anybody else from the outreach team, what your experiences have been with that collaborative nature and how important that is to the work that we're doing to end homelessness.
For sure, Sean. So I think it's really cool that you highlighted that over 50% of the youth that we work with are LGBTQ. And these youth don't always feel comfortable for whatever reason, going to other drop-in centers or whatever the case may be. Friendship Place, a part of outreach is having good relationships with other providers and housing programs to make sure that our youth are safe and comfortable wherever they go, and that's our priority. Something unique that Friendship Place has done in the past, just a great story that we can highlight on is a youth who was in the youth system and then turned 25, and it was a point where we got to collaborate in our own with the adult and youth programs that we have. And we were actually able to help this trans youth get housed for the first time in her life on her own. And she actually passed away, but she was housed for 2 years successfully with the assistance of Friendship Place. And it was the first time that she had ever had her own place in her own name. And she was able to maintain that, and she passed away comfortably in her own home. But as Sean mentioned, the nature of collaborating with other people is very important in this line of work, and being able to redirect and try to mend relationships. Because sometimes youth we meet are, different out on the streets as they would be inside of a drop-in center or inside of a traditional case manager's office, which is why a lot of our youth and participants are pretty successful in getting different things done. I think in outreach it's important to highlight small victories. Our ultimate goal is housing, but we have to focus on the participant goals and try to do client focused things. So if their goal is to get an ID or a birth certificate or to figure out where to shower every day or take a laundry, we have to appreciate as outreach workers these small victories.
Yeah, and I would just highlight the uniqueness of the Friendship Place program. And most programs that we collaborate with work with specific clientele, whether it's adults or it's youth or specifically LGBTQ. Friendship Place works with everyone, and we make everyone comfortable, and we have the ability to warmly hand off individual to another part of our organization, whether it's the adult outreach team, whether it's the Before 30 program. All of these programs work together, and we try to work with each other to help people get to where they are. And I think that's very, very important. Street outreach is very, very important, and being able to have the things that we need, such as, waters and socks and helping people get food. All those things are things that we need when we out on the streets to help build relationships with individuals to take those baby steps in order to get them to the next level in their life.
Thank you. One question that's in the chat. Are you finding that people are afraid to go into shelters because of COVID-19, and is that leading to more people on the streets? What's your experience been so far?
I think for the most part, on the youth side, young people are very transit, and what we're seeing on the youth side is that a lot of people are being generous over the COVID-19. Families are coming together. People are looking out for one another. People are letting people stay with them during this time, and with stipulations that they can't leave, they can't, stay out and things like that. So on the youth side, we've been seeing a lot of more unity and people trying to stick together to help one another. So that's been beautiful. Liza, if you want to speak on some of the adult stuff.
Yeah, I think that, again, I don't, just wanted to qualify this as I don't have a before experience, so I'm not sure firsthand what the landscape looks like beforehand, but as far as individuals I've encountered, I'd say that it definitely speaks to sort of the education work that's been done by outreach workers too, and sort of in making sure that the important safety information about how about the realities of COVID and how to stay healthy and safe during this time, that's definitely being passed on to the population that is experiencing homelessness on the streets at the moment. But some of the individuals that I have experience with, there is definitely an increased fear of going to shelters or going to some of their health providers, or because of the risks associated with COVID. And another unfortunate thing, or thing that sort of the outreach team are starting to deal with too, is because of the sort of paranoia associated with the disease, that has sometimes been exacerbated too, but with some of the mental health issues that people living on the streets are experiencing. So it can kind of feed that a little bit more too. But that sort of definitely speaks to the role of outreach when that paranoia is sparked, that the role of the outreach worker is really to sort of kind of help build that trust and be a contact when maybe other places and other people might bring on more fear for people.
One of the questions someone raised in the chat is, are we able to offer COVID testing referrals? Sean, did you have a thought on that?
Yeah, we are not able to do COVID testing directly in our capacity, but since the pandemic started back in mid-March, the outreach teams have been equipped with guidance both from the DC Department of Health and the Department of Human Services on questions to be asking individuals who are unsheltered. And so that is something that we have been doing throughout this time. That guidance has remained pretty static and has been working out pretty well. What it has done though over the last several months is if you are reading the news that DC has been making more widespread testing availability, which is very helpful, as well as just in the last couple of weeks they've also increased access for antibody testing. So the testing as a whole has increased, and also there's been focus specifically with the vulnerable population of individuals experiencing homelessness because of other health factors and age. That has been really important. And so they have focused on having remote quarantine sites designated for individuals who are both in shelters as well as unsheltered. They have also been working to create a plan for identifying the most medically vulnerable individuals and trying to fast track them to housing opportunities and destinations, which is really, really important because that's one of the things that we do in housing assessment is working to evaluate who is most at risk of dying in a state of homelessness. We would, just as Sierra had shared about the individual who we were able to help in housing, that individual was able to, unfortunately they passed away, but they were able to die with dignity in a place of their own. And so that is a focus of what we try to do at Friendship Place. We also do distribute hand sanitizer, masks, gloves as we have available, and I will say thank you to our generous donors who have given to our COVID response fund in our organization. That has helped to make that happen, as well as many volunteers who have spent countless hours hand making masks as well for our organization, both for our staff and for distribution. Thank you, thank you, thank you. You are helping to keep us safe on the streets as well as our participants who are in need. I will also say this because it had come up in a conversation last week that there is fear and apprehension among many individuals for not wanting to go into shelter because of the congregate setting. And so we have seen an increase in unsheltered homelessness in conjunction with the warmer season, that we do see a rise in unsheltered homelessness as it gets warmer out. The other thing that's really important that I know that we want to focus on with our individuals who are unsheltered is just to be able to continue to engage with routine medical care. And because there is that apprehension that if going to a hospital, going to a clinic, that there could be that exposure. But we also want to make sure that people have access to medical care if at all possible, so that there's not this additional impact of not addressing routine medical conditions or chronic medical conditions that could put them at a higher risk, one, to COVID, but overall of having health complications.
Thank you. We have a question in the chat about what opportunities might there be to give online job coaching to some of the youth that we come across, that we work with on the street. So, Sarah, that may be you, but I guess it's open to anyone.
I would say, we try to do street outreach, and, we have an obligation to be on the streets about 75% of the time. So with the capacity to do online job coaching, we are able to help some young people with tweaking resumes and things like that at times. But the capacity to just do online job coaching, I think we would try to refer to some of our other agencies for that, but we definitely would do that warm handoff to help the young person get, the online job coaching or whatever the service they might need.
That kind of leads to another question that you all have mentioned before, that interconnectedness. I mean, we're very fortunate at Friendship Place that we have a number of different programs that use people in different places. Can you speak to some of examples of where you've referred somebody to another Friendship Place program where we've been able to keep that sort of continuum of care?
Yes. So we work with Aim Higher. When the Welcome Center was open at full capacity, I know Aim Higher was always really great and responsive. And they even have a Spanish-speaking director now as well. So he is able to even work with clients that speak Spanish. So, within Friendship Place, we have a lot of great programs. But I would say during outreach and in the Welcome Center, we do collaborate at times with Aim Higher. And we also have a lot of really great relationships in the city. It's very vital to have relationships and as an outreach worker to know where people can get things done successfully. Because it can be traumatizing, without doing research, if someone just refers you somewhere without knowing the environment, the staff, if it will be successful, if it will be open or closed. Especially now in COVID, it's so important to call ahead, do research when referring people places.
Great.
Shayla, you have something to say?
I probably say, because we do outreach all over the city, where the youth outreach specialist, I come in contact with adults, and sometimes they're veterans. And so we have a veterans program and an outreach team that specifically works with veterans. If I ever run into a veteran, I will connect them with our VETS program, and that's something that I think I work very closely with when it comes to friendship places. Once again, like Sierra says, aim higher. I direct people to aim higher at least once a week, if not more.
Great.
Yeah, and I will also add that we do have the Friendship Place Before 30 program, where we see some of our youth who age out of our youth system at 25 and not as vulnerable as might want them to be in the adult system. So just having that small gap between 25 and 30 where we're able to get some type of resources through our program is definitely wonderful to fill that gap where some of those young people fall through the crack because of age and because they're not being as vulnerable as some other folks are.
Thank you. We had another question. Someone mentioned that they work in a gallery place and they do come across many homeless adults sleeping on the street. Although we focus Upper Northwest, what can we encourage people to come across there to do?
I would say if you run across someone on the streets that, of course, if they look like they dehydrated, they tired, or, sick, I would call 911, take precaution and call 911. They do have an outreach provider in the downtown business improvement district and a day center down there at Pathway to Housing, I believe, provide outreach in that area. So it is a website that we can get to you guys that they have on the District of Columbia website where it tells you which outreach provider provides what provides outreach in which area. So maybe you can contact that directly, and you can also contact the shelter hotline where and they can get us the help.
And the shelter hotline, if you want to call anyone, is 202. I'll give you a second to grab a pen. 202-399-7093, and then you can point. That'll help point people towards assistance here. We have a question from Maryland, someone who lives just over the line in Chevy Chase. What should she or anyone do if they come across someone who needs help in Maryland? Can they call our hotline? Is there a place in Maryland that they should point people for assistance?
And this is just over the line, right? It's very close to the...
Yeah, 2 blocks over the line is the question.
So my recommendation, and I've been putting a lot of information into the chat bar here with some phone numbers and other information. Definitely you're always welcome to call our hotline, which is 202-364-8907. And that is generally a message service, so that is a phone number that is site-based that we are able to receive remotely during this time, so it's not going to be necessarily an active pickup and respond, but leave a message. We have had to work sometimes with our partners in Maryland just because their system is set up a little bit differently than the districts, and so it's sometimes it's a provider base, sometimes it's a larger county response, and it has changed a bit year to year. So sometimes we do need to do some digging on our side rather than us saying, hey, call these people. We always want to make sure that we're giving accurate information, and so I would say if that is a question that we can do the digging and then help to respond based upon that.
We have a question in the chat regarding the the medical clinic that we had been working with Unity, and in this time, what are we doing in the way of healthcare or medical outreach?
I'm happy to, to speak real briefly on that too. So, because of operations, our Welcome Center has been closed for our regular drop-in services since the middle of March. We have been helping to direct people to the Upper Cardozo Clinic in Columbia Heights, which is the closest physical location. Friendship Place is actually considered an outreach post under Unity Healthcare. And so what has happened during this pandemic is that all of the outreach posts for Unity have basically been closed, and they have worked to bring those providers to other key locations, either helping out at some of their major brick and mortar clinics, but those providers have also been pulled into some of the hotel sites, which have been used to help reduce the overpopulation in the shelter system, so that there is reducing the spread. And it has worked really well in the city. That there has been a significant decline in the number of cases from what it was. Unfortunately, there have been approximately 20 individuals in the homeless services system that have died as a result of COVID. But we have seen the downward trend, which has been very much in line with what the district's cases have been trending and flattening the curve. So although Friendship Place has not hosted Unity Healthcare since mid-March, we have been routinely engaged with them, in some cases helping people to get connected to telemedicine sessions with Unity, but also helping some individuals who have had their prescriptions written by providers at our site to be able to help them get their prescriptions refilled.
Yeah. And also just some of our young folks that need like TB tests and things like that to get in certain programs, they do have a walk-in clinic over on Minnesota Avenue. So we have been referring folks over to the Unity Minnesota Avenue Clinic, and they're doing walk-ins mornings and afternoon walk-ins.
Great. We have another question in the chat box. Have the street outreach specialists had experience helping youth who are victims of trafficking, and how have you addressed that?
Just for the most part, keeping it confidential, and getting it to the right authorities, and that could be just MPD, that could be some type of safe house, where each case is different, each case is unique. So making sure that we covering, crossing our T's, dotting our I's, making sure that we're going within the best interest of the person in line with the guidelines of reporting to the right authorities.
Very good. I don't know, Sheila, you had anything you wanted to add on that, or? Oh.
I have personally worked with a youth that was a victim of trafficking, but there are specific programs, housing providers within the city that we do have partnerships with that have case managers and have their own specific guidelines on working with those types of youth because of the trauma they might have experienced. But mostly it's just referring them to programs that are interested in that type of.
So, one question I think that is always on a lot of our minds is when we come across someone who's living on the streets, whether they're near our homes or our workplaces, what's an immediate thing we're able to do for someone, particularly during these very hot times? How would you recommend we approach someone who might need assistance, or any advice you might have?
So in these really, really hot times, just making sure people are hydrated if they're okay, and that can just be, hey, are you okay? If you have a water bottle on hand, and then, calling the appropriate number, like we have our Friendship Place outreach number. There's a shelter hotline through DC. And just engaging people with your level of comfortability, because many people, you could just talk to them and see if they're okay. And if they want to be transported somewhere, there's numbers you can call in DC that will transport them to a cooling center, so they can be able to cool off inside somewhere.
Very good. We do have some more time if anyone wants to pose a question in the chat box, but I think there's one I'd like to pose now. And certainly you come across people in need, and can you any of you speak to some real success stories where you've been able to get someone the assistance they need, or really help them get the things they need? And what's been particularly moving to you as folks who are doing this work? And that's open to anyone.
So I can talk about the early days for me. The gentleman who was living on the street, he was there in the winter, he was there in the summer, and I remember he was wearing a lot of clothing. We knew it had to be too hot, and we activated the city team a few times to try to get him into a hospital because we knew he was having some psychiatric issues. And then one summer, it was a food infection that allowed the team to actually say, okay, he needs to go in now, he needs to be seen in the hospital. And then we followed him from the hospital into a group home placement where he lived for many years after that. So, it was really telling that we kept trying as this outreach team back in the day to get this person for some support, and then we knew that on the psych side, of course, he needed it. But then people pull themselves together in front of the mental health team, and often the mental health team has to move on. But this foot infection in the middle of the summer allowed us to see this gentleman all the way into a group home placement. So that has left a good memory for me.
No, that's wonderful. Anyone else want to offer? So I have a next question that I can move to.
A great success story for me would be, it's always memorable because we navigate people through the housing, the CAP system all the time in the system. But when I just started was a youth was staying in a tent, actually down Gallery Place. And I was able to see her through the process. There's not very many permanent supportive housing spots in the youth system, unfortunately. But I was able to walk her through, doing the original housing assessment, the full housing assessment, and then going with her to her intake with her housing provider. She's still housed to this day. I keep in touch with her. She's not a youth anymore, but she's been housed for almost 3 years now. From going to a tent to seeing someone, being able to, and once she got housed, she was able to get her benefits, work on herself, get connected to mental health services start to put the pieces together. And she's really thriving in her housing placement. So I'm just really happy for her.
Oh, that's wonderful. Yeah. Sorry.
Oh, that's okay. I was going to just add to some of the continued success stories. I think, for me, being so new in my position, every little victory feels like a success. The story I shared at the beginning, being able to sort of see someone be connected to a housing resource and be matched in a housing lottery, for me felt like the largest success. But I think outreach is about a lot of those smaller successes, and that I feel like I'm really feeling right now, because I'm so new to the role, but it's giving somebody who's sleeping some water and seeing him, feel just so happy that somebody took the time to stop and give him a bottle of water and be able to talk to him, or somebody that I'm working with, like, kind of move incrementally from accessing his birth certificate to now getting his social security card to now having SNAP benefits like this down the road, or talking to a new person the other day who at first, seemed like it would be really difficult to have a conversation with, but just through sort of through standing with him, being able to eventually develop a rapport where I was able to kind of find out more information about what I could do to help him. That felt like a win. So the successes are small and large, but I think that the small victories really kind of help propel you forward to be able to try and do more to get people connected to services.
Thank you.
And I would just finish it off with just saying, like, a successful me is just saying the team grow, saying the outreach program grow, then with an organization that really understand the importance of what we do and why it's important in the process of helping to end homelessness. So I really appreciate that Friendship Place takes outreach really serious, and that a successful me is just saying, and my team growing and watching them speak with so much knowledge and passion. That's very, very, very good to me. So thank you, guys.
Mm-hmm. Thank you, Antoine.
So there's one last question that I think is a great way to, first of all, it comes with a compliment for all of you. The outreach specialists on this call are very impressive. But the follow-on question is, so what is it that's in your background that's giving you the tools to be so effective? And either any of you can start. Antoine?
Oh, my tools is just being myself, being genuine, being a people's person, I like to talk, talkative. Those are all the things that you need: polite, respectful. All those things will help you to be one of the best street outreach workers in the city.
Liz, what about you?
I completely agree with Antoine. I completely agree with him. You have to be a people person, and you just want to remind people that, like, you're there for them, and being completely genuine. I think, for me personally, I was in the housing system when I was younger in life, and just reminding myself what it was like, and the challenges, and just being there for another person as I navigate that is, I think, exactly why I do this and why I got into this profession.
Right.
Yeah. I was just going to echo that too. It's really, this is my first direct service position, and so I was excited to apply, and I wasn't sure if that was how that would be considered when they were thinking of me as an applicant, but I really appreciate that Friendship Place does take into consideration that really what makes a person an effective person in this role in providing services. That fact is having the desire to do the work and being a people person, and that is what can make a person be effective. So they took a chance on. I haven't had experience doing in the poverty services world, but not the direct service role, and I think the fact that they take the chance on the people who show that they care and they want to do the work is what makes people good at their job.
Thank you.
I think being willing to listen to someone and kind of sit down and listen to their goals and being very client-centered and practice harm reduction and work at, the participant's pace, because we may have something in mind for you, like, it would be great if you're in this program, or it would be great if you did this or that, but it's really about what the person wants, doing person-centered services and just making sure that we keep the client's interest in mind, what they want to do.
Yeah.
Just to add to that, just to add to that, Sierra, just the diversity of the team, we're really able to touch anyone. So, I would just leave it as that, you know.
And I will speak as someone who has had the opportunity to be in the interview process with every single one of these outreach workers. The ability to embrace empathy is what I have seen to be the most successful part of what this team has been able to do, to be able to recognize trauma, pain, hardship, and to be able to sit with that has made it successful for this team. And as Sierra and everyone has said, understanding that the participant comes first and working to understand from their perspective and to see where their goals are, that's what makes this group successful in helping to end homelessness. So I'm going to do this for these fine staff members, and thank you for contributing in this way and in the conversation today.
Yes, I mean, thank you, all of you, for taking the time out of your day. Antoine, Liza, Sheila, Sierra, and this has just been so interesting, so informative. I think we've answered some great questions. Sean and Jean-Michel, what are your closing comments and thoughts?
Yes, a round of applause definitely from me also. And yes, I agree with Antoine and Sean. You know, it takes a sense of mission, of course, but that passion, the knowledge, and you have to put a lot of heart in this work, right? You have to love people up. Otherwise, they might just walk away and you'll never get a chance to serve them again. So, again, I want to commend the whole outreach team and Sean, and I want to thank you all for being on the call. Thank you all for your support. We appreciate you.
Thank you again, and I hope everyone has a great, hopefully fairly cool rest of the day, and we'll be back in touch with future webinars like this. So thank you, and have a great day, everyone. Take care.